I'm about to show you the single most important blood pressure reading that almost every standard checkup misses, and why your usual numbers might be hiding a serious risk. Most older adults walk out of their doctor's office thinking they are completely safe because their seated measurement looks normal, but they are failing to check the one specific reading that predicts falls and cardiovascular events more accurately than any other. Arthur was 74 years old when he started noticing that he felt completely fine while watching television in his recliner, but the moment he walked to the kitchen, he felt a strange wave of unsteadiness. His doctor was pleased with his routine checkups because his blood pressure was consistently 120/80 whenever he sat in the exam room. However, Arthur continued to feel these frightening spells of dizziness at home, and he began to worry that something severe was happening to his brain. It turned out that his doctor, like many others, was looking at the right numbers but in the wrong context, missing the hidden reading that reveals how your heart handles gravity. Before we begin, a critical disclaimer. The information I'm sharing today is strictly for educational purposes and should not be considered medical advice. I am not your personal physician and cannot provide individualized medical guidance through this video. Never stop, start, or change any blood pressure medication without first consulting with your doctor. 1. You need to perform the stand-up test at home to detect a condition that is invisible when you are sitting down. Most seniors have been trained for decades to sit still, relax, uncross their legs, and remain perfectly quiet while the cuff inflates, which is absolutely the correct way to get a resting baseline reading. However, living your life requires you to stand up, walk around, and move against gravity, and for many adults over 60, the blood pressure system struggles to adjust quickly enough to these changes in position. This creates a hidden danger zone where your pressure might be perfect when you are resting in a chair, but it plummets to dangerous levels the moment you stand up to answer the phone or go to the bathroom. This phenomenon is often missed in a busy clinic environment because there is rarely enough time to measure you in multiple positions, yet it is a leading cause of fainting and falls in the senior community. Margaret came to me because she was convinced she was developing a neurological problem after she fell twice in her hallway within a single month. She was 78 years old and had been managing her high blood pressure with medication for 15 years, always priding herself on keeping her numbers strictly within the range her doctor recommended. When we reviewed her home log, everything looked pristine, with readings consistently sitting around 125/75, which should have been a sign of perfect health. The problem was not her resting pressure, but what happened to her pressure when she transitioned from her morning chair to her kitchen counter to make coffee. We discovered that while her seated pressure was stable, her standing pressure dropped by nearly 30 points, momentarily starving her brain of oxygen and causing her legs to give out. This condition is technically known as orthostatic hypotension, but you can think of it simply as a lag in your body's hydraulic system. When a younger person stands up, their blood vessels instantly constrict to push blood up against gravity to the brain, maintaining steady pressure without a second thought. As we age, the sensors that trigger this constriction can become less sensitive, and the blood vessels themselves can become stiffer and slower to react to the signal. This means that when you stand up, gravity pulls a significant amount of blood down into your legs and belly, and if your body doesn't clamp down quickly enough, your top number drops rapidly. If you are taking medication to lower your blood pressure, this effect can be exaggerated, pushing your standing pressure too low even if your sitting pressure is just right. To find out if you have this hidden reading, you need to conduct a specific sequence of measurements in the quiet of your own home. You should start by lying down flat on your bed or a comfortable sofa for at least 5 minutes to ensure your body is completely at rest and your fluids have equalized. Take your blood pressure while lying down and write that number on a piece of paper so you have a clear baseline of what your body does when gravity is removed from the equation. Once you have that number recorded, stand up slowly and wait exactly 1 minute while remaining standing, ensuring you have a sturdy chair or counter nearby for safety in case you feel lightheaded. After standing for 1 minute, take your blood pressure again while keeping your arms supported at heart level, and then write this second number down next to the first one. You are looking for a specific difference between the two top numbers that serves as a warning sign for your circulation. If your top number drops by 20 points or more when you move from lying down to standing up, or if your bottom number drops by 10 points or more, you are dealing with this hidden volatility. For example, if you are 130 when lying down, but you drop to 105 when you stand up, that is a significant shift that your doctor needs to know about immediately. This drop indicates that your cardiovascular system is not compensating for gravity efficiently, which puts you at a much higher risk for dizziness, confusion, and accidental falls in your own home. A recent study published in a major geriatric medical journal highlighted that this specific drop in standing blood pressure is often a better predictor of future fall risk than balance tests alone. The study found that many seniors who were treated aggressively to lower their resting blood pressure ended up with standing pressures that were too low for their brains to tolerate comfortably. This does not mean you should stop your medication, but it does mean that the target number you and your doctor are aiming for might need to be adjusted based on how your body handles standing up. If you only ever measure while sitting, you are seeing only half of the picture, and you might be taking a dosage that is perfect for your chair but dangerous for your daily life. Here is another simple habit you can adopt to manage this if you discover you have a drop in pressure. Before you get out of bed in the morning or before you stand up from a long period of sitting in your recliner, make a habit of pumping your ankles up and down for 30 seconds. This simple mechanical action uses the muscles in your calves to physically push blood back up toward your heart before you ask your body to fight gravity. It acts like a manual pump that primes your system, ensuring that there is enough circulating blood available to maintain your pressure when you finally rise to your feet. It is a small adjustment, but for someone like Margaret, it was the difference between walking confidently to the kitchen and feeling the room spin. 2. You must pay close attention to the gap between your top number and your bottom number, which is a reading called pulse pressure. Most seniors are conditioned to focus almost exclusively on the top number, known as systolic pressure, because that is the number that typically rises with age and gets the most attention in medical headlines. However, the relationship between the top number and the bottom number tells a much deeper story about the actual stiffness of your major arteries. As you age, your arteries naturally lose some of their elasticity, becoming more like rigid pipes than flexible hoses. And this change is revealed not just by how high the top number is, but by how far away it is from the bottom number. James was a 69-year-old retired engineer who loved data and kept an immaculate spreadsheet of his daily blood pressure readings for over 3 years. He came to see me because he was confused. His top number was consistently around 135, which he knew was slightly elevated but not terrible, and his bottom number was often around 60 or even lower. He thought the low bottom number was a sign of a strong heart, assuming that lower was always better when it came to cardiovascular health. The reality was that his wide gap, 75 points between the top and bottom, was a flashing warning light that his arteries were stiffening significantly, forcing his heart to work much harder with every single beat than the raw numbers suggested. The top number represents the maximum pressure in your arteries when your heart squeezes, and the bottom number represents the pressure when your heart relaxes and refills with blood. In a flexible, youthful arterial system, the arteries expand to absorb the force of the squeeze and then gently recoil to maintain pressure during the relaxation phase. This natural cushioning effect keeps the top number from shooting too high and keeps the bottom number from dropping too low, usually maintaining a gap of about 40 points between the two. When the arteries become stiff and calcified over decades, they lose that ability to cushion the beat, causing the top number to spike higher and the bottom number to drop off sharply because there is no elastic recoil to hold the pressure up. For adults over 60, a pulse pressure gap of more than 60 points is considered a significant marker of arterial aging and cardiovascular risk. In James's case, his gap of 75 meant that every time his heart beat, it was slamming blood against a resistant system that wasn't flexing to accommodate the flow. This creates a high-velocity wave of pressure that can travel into the delicate vessels of the brain and kidneys, causing micro-damage over time that doesn't show up on a standard cholesterol test or EKG. While James was celebrating his low bottom number of 60, it was actually a sign that his stiff arteries were allowing pressure to drop too quickly between beats, which can compromise the steady flow of blood to the heart muscle itself. Comment your age and usual top number range below so we can see how common these variations are in our community. This concept of the gap explains why you might sometimes see a high top number paired with a surprisingly low bottom number, a condition known as isolated systolic hypertension. It is the most common form of high blood pressure in seniors, and it requires a different way of thinking than the high blood pressure seen in younger people where both numbers are high. If you simply try to crush the top number down with aggressive medication without considering the gap, you might drive the bottom number down too low, which can be dangerous because the heart muscle receives its own blood supply primarily during that relaxation phase. If the diastolic pressure drops too low, typically below 60, your heart might not be getting enough oxygen even while it is working overtime to pump. Managing this gap often requires a focus on lifestyle changes that improve arterial flexibility rather than just lowering fluid volume in the body. Gentle, rhythmic aerobic exercise like walking is one of the most effective ways to encourage arteries to regain some natural dilation and flexibility. Unlike high-intensity bursting exercises, steady walking sends a consistent, pulsing signal to the lining of your arteries to produce nitric oxide, a gas that naturally relaxes the vessel walls and helps close that gap over time. For James, shifting his focus from just lowering the numbers to improving flexibility through consistent daily walking helped narrow his pulse pressure and protect his organs from that damaging wave of force. 3. You must ensure you are not falling victim to the cuff mismatch error, which is a technical failure that creates a hidden false reading on your machine. This is one of the most frustrating aspects of home monitoring because you can be doing everything else right, eating well, sleeping enough, taking your meds, and still get a number that sends you into a panic unnecessarily. If the inflatable bladder inside your blood pressure cuff does not wrap around your arm correctly, the physics of the measurement break down completely, and the machine will display a number that has nothing to do with your actual health. This is particularly common in seniors who may have lost muscle mass in their arms, or conversely, those who carry a bit more weight in the upper arm area. Elaine was 72 and had been prescribed a second blood pressure medication because her home readings were consistently showing 150/95, despite her strict diet. She was experiencing fatigue and lightheadedness, symptoms that suggested her pressure might actually be too low, yet her machine kept telling her it was dangerously high. When she brought her monitor into the office, we immediately saw the problem. She was using the standard one-size-fits-all cuff that came in the box, but her arm circumference was slightly larger than the average. The cuff was struggling to stay closed and wasn't compressing her artery efficiently, so the machine had to inflate much tighter to get a reading, artificially driving the numbers up by nearly 20 points. The bladder inside the cuff, the part that actually fills with air, needs to encircle at least 80% of your upper arm to give an accurate reading. If the cuff is too small for your arm, the machine has to overinflate to pinch off the artery, which results in a reading that is falsely high, sometimes significantly so. Conversely, if you have lost weight and your arm is quite slender, using a large cuff can result in a reading that is falsely low, giving you a false sense of security when your pressure might actually be elevated. This mismatch is a hidden mechanical error that leads thousands of seniors to be over-medicated or under-medicated every single year, simply because the equipment doesn't fit their specific anatomy. To avoid this hidden error, you need to measure the circumference of your upper arm at the midpoint between your shoulder and your elbow using a flexible tape measure. Once you have that measurement in inches or centimeters, compare it strictly to the range printed on the side of your cuff or in the manual. If your arm size falls outside the range, or even if it is right on the borderline of the maximum size, you need to order a different size cuff from the manufacturer. Most monitors have interchangeable cuffs, and getting the correct size is a one-time adjustment that will ensure every single reading you take for the next 5 years is actually true. Another aspect of this setup that often hides the real number is the position of your arm relative to your heart. For every inch that your cuff is below the level of your heart, your blood pressure reading will appear roughly 2 points higher due to the weight of the column of blood in your arm. If you sit on your sofa and let your arm dangle at your side while the machine runs, your cuff could be 10 inches below your heart, artificially adding 20 points to your top number. Elaine was taking her readings at her kitchen table, but the table was too low, causing her to lean forward and drop her arm down, compounding the error from the small cuff. Here is another helpful step to ensure you are getting the absolute truth from your machine. When you sit down to measure, you must support your arm on a surface so that the cuff is at the same vertical height as the center of your chest. You might need to use a cushion or a pillow under your arm to raise it to the correct level if your table is too low. You should also ensure that your back is supported against the chair and your feet are flat on the floor, uncrossed. Crossing your legs at the knees compresses the veins in your legs and can temporarily raise your blood pressure by nearly 10 points, adding more noise to the data and hiding your true baseline. 4. You need to check for the morning surge, a hidden spike in blood pressure that occurs specifically in the first few hours after waking up. Many older adults prefer to take their blood pressure later in the day, perhaps in the afternoon or evening when they have settled down and have more time. While these readings are valuable, they often miss the most volatile period of the 24-hour cycle, which is the window between 6 a.m. and 10 a.m. This morning window is statistically when the highest number of cardiovascular events occur, and if you never measure during this time, you might be completely unaware that your system is undergoing a massive stress test every single morning while you are making your toast. Robert was a 70-year-old man who was very diligent about his health, checking his pressure every day at 5 p.m. before watching the news. His afternoon readings were always excellent, usually around 118/76, so he assumed his blood pressure was perfectly controlled. However, routine blood work showed signs that his kidneys were under some strain, which puzzled his doctor given his great afternoon numbers. We asked Robert to perform a 1-week experiment where he measured his pressure immediately upon waking, before coffee and before medication. The results were shocking. His morning readings were consistently spiking to 160/95, a dangerous surge that was happening daily but resolving by the time he checked it in the evening. This morning surge is driven by your body's natural circadian rhythm, specifically the release of cortisol and adrenaline that serves as your internal alarm clock to wake you up. In a young, healthy body, this chemical release causes a gentle rise in heart rate and pressure to get you ready for the day. In seniors, especially those with stiffer arteries or those who may have sleep apnea, this chemical dump can cause an exaggerated, violent spike in pressure that puts immense strain on blood vessels. Because Robert was taking his medication in the morning, the protection from the previous day's dose was wearing off just as this natural hormone spike was hitting its peak, leaving him unprotected during the most dangerous hours of the day. Most older adults can try this safely to see if they are experiencing this hidden pattern. For the next 3 days, keep your monitor on your bedside table so you don't have to walk far to get it. When you wake up, go to the bathroom if you need to, but then sit down immediately and take a reading before you engage in any major activity, before you eat breakfast, and certainly before you have any caffeine. Caffeine is a stimulant that can briefly spike pressure even further, so you want to capture the number that your body is producing naturally. If you find that your morning numbers are consistently significantly higher than your evening numbers, you have uncovered a hidden risk factor that might require a change in when you take your medication. This phenomenon is also closely linked to how well you sleep, and specifically whether your blood pressure dips at night like it is supposed to. Normally, blood pressure should drop by about 10 to 20% while you sleep to give your cardiovascular system a rest. People who have this aggressive morning surge often do not have that nighttime dip, meaning their arteries are under high pressure 24 hours a day without a break. By identifying this morning pattern, Robert was able to switch his medication timing to the evening under his doctor's supervision, ensuring he had maximum protection on board during those critical early morning hours, which eventually protected his kidneys from further damage. Understanding the timing of your body's rhythm is just as important as the number itself. If you only look at the road when it is straight and flat, you will never know how your car handles the sharp turns. The morning surge is that sharp turn, and checking it gives you a complete picture of your safety. By simply adding a morning check to your routine a few times a week, you stop guessing about your health and start managing it with precision. One more easy change is to ensure you are warm enough when you take this morning reading. Cold temperatures cause blood vessels to constrict to preserve body heat, which will naturally drive your blood pressure up. If you wake up in a chilly bedroom and immediately sit shivering in your pajamas to take a reading, you might see a falsely elevated number that is just a reaction to the cold air. Put on a robe, sit in a comfortable temperature, and give your body a moment to adjust to the morning before you press the start button. This ensures that the number you see is a reflection of your internal health, not just the thermostat setting. You need to implement the hydration buffer, which is a same-day lever specifically designed to stabilize the hidden reading we discussed at the very beginning. Many seniors suffer from the dangerous drop in standing blood pressure simply because their total blood volume is running too low, effectively trying to pump fluid through a system that is only partially full. As we age, our natural thirst mechanism becomes less sensitive, meaning the signal that tells your brain you are thirsty arrives much later than it did when you were 30. This leads to a state of chronic low-grade dehydration that might not make you feel thirsty but makes your blood volume unstable enough to cause those hidden pressure drops when you stand up. Clara was 76 years old and had accepted her morning dizziness as just a normal part of aging, something she had to live with, like her arthritis. She told me that every time she got out of bed, she had to hold onto the dresser for 10 seconds until the room stopped tilting, a classic sign that her blood pressure was crashing upon standing. She was already drinking water with her meals, but she avoided drinking in the morning because she didn't want to rush to the bathroom, creating a long window of time where her tank was running on empty. We made one specific change to her routine that didn't involve medication: drinking one full glass of water roughly 15 minutes before she planned to get up and start her active day. This strategy works because water acts as a rapid physical volume expander in the bloodstream, providing an immediate boost to the hydraulic pressure inside your vessels. When you drink roughly 10 to 16 ounces of water fairly quickly, it triggers a sympathetic nervous system response that slightly tightens the blood vessels and increases the volume of fluid the heart has to pump. For a senior with stiff arteries or a sluggish response to gravity, this extra fluid acts as a buffer, preventing the bottom from falling out of your blood pressure reading when you stand up. Within a week of starting her pre-flight hydration routine, Clara noticed that the room no longer tilted when she stood up, and her standing blood pressure numbers stabilized significantly. This approach is particularly powerful because it is mechanical rather than chemical. You are simply giving your heart more fluid to work with so it can maintain pressure against gravity. It is important to note that this is not about drinking gallons of water all day, which can be dangerous for people with certain heart or kidney conditions. It is about the strategic timing of water intake to counteract the specific moments when your pressure is known to drop, such as in the morning or after a heavy meal. Post-meal hypotension, or a drop in pressure after eating, is another hidden reading that many seniors miss, caused by blood rushing to the stomach to aid digestion, and a strategically timed glass of water can help mitigate that drop as well. If you have heart failure or are on strict fluid restrictions from your doctor, you must ask them before adding extra water to your routine. However, for the majority of older adults who are simply dealing with orthostatic changes, this is the safest and most effective tool available. It empowers you to control your own physiology with something as simple as tap water, turning a daily risk of falling into a manageable part of your morning routine. If you know someone over 50 who could benefit from this, share this video. 6. You should consider the isometric hold technique, a movement lever that lowers resting blood pressure without the need for high-impact cardio or running. Many seniors avoid exercise because they believe the only way to lower blood pressure is to get on a treadmill and sweat until they are out of breath, which can be daunting if you have bad knees or a bad back. Isometric exercises are completely different. They involve contracting a muscle without moving the joint, effectively squeezing the muscle against resistance while holding still. This type of training has been shown in recent studies to be incredibly effective at lowering resting blood pressure because it retrains the nervous system's control over your blood vessels. Thomas was an 81-year-old former carpenter who had severe osteoarthritis in both knees, making walking for long distances painful and running impossible. He was frustrated because his doctor kept telling him to exercise more, to bring his numbers down, but every time he tried to walk briskly, he paid for it with days of joint pain. He felt trapped between his high blood pressure and his aching joints, assuming that his health would just deteriorate because he couldn't do real exercise. We introduced him to isometric hand grip training, a method where he simply squeezed a specialized resistance tool or even a rolled-up towel for 2 minutes at a time while sitting comfortably in his chair. When you squeeze your hand muscles tightly and hold that tension, you create a temporary surge of pressure that sends a strong signal to your brain. In response, your body activates its natural baroreflex, which is the system that regulates blood pressure, teaching it to calm down and lower the pressure once the squeezing stops. It is essentially a way of resetting your body's internal thermostat for blood pressure, training your vessels to relax more profoundly when you are at rest. After 8 weeks of doing these grip exercises 3 times a week while watching TV, Thomas saw his resting systolic pressure drop by 12 points, a result that is comparable to taking a mild medication, all without taking a single painful step. This creates a massive opportunity for seniors who are mobility challenged to still actively lower their blood pressure. You can do this at home using a simple stress ball, a gripper tool, or even by performing isometric wall sits if your legs are strong enough. The key is the sustained tension, holding the squeeze for about 2 minutes, resting and repeating, which triggers a unique physiological pathway that standard aerobic exercise doesn't always touch. It is crucial, however, that you breathe continuously while you are squeezing. Never hold your breath, as that can spike your pressure dangerously high in the moment. Breathing calmly and rhythmically during the hold ensures that you get the benefit of the muscle tension without the risk of the Valsalva maneuver, which is the strain you feel when holding your breath. This technique is gentle on the joints, requires zero equipment, and can be done in your living room, making it the perfect hidden lever for anyone who feels limited by their physical mobility. For Thomas, it gave him back a sense of control, proving that he didn't need to be an athlete to improve his heart health. He just needed to be consistent with the right kind of tension. Most older adults can try this safely, but if you have uncontrolled hypertension, meaning your numbers are currently very high and unstable, you should check with your doctor before starting isometrics. Once you get the green light, it is one of the most efficient tools in your arsenal, offering a high return on investment for very little physical impact. It changes the definition of exercise from moving fast to squeezing hard, opening a door for millions of seniors who thought their exercise days were over. 7. You must look at the potassium-sodium ratio, a hidden nutritional balance that is far more important than just looking at the salt shaker alone. For decades, seniors have been told that the only way to control blood pressure through diet is to cut sodium, leading to bland, flavorless meals that make life miserable. While reducing excess salt is important, the human body actually regulates blood pressure based on the balance between sodium and potassium, not just the absolute amount of sodium. Your kidneys use this ratio to decide how much fluid to hold on to and how much to flush out. If you have high sodium but also high potassium, your body can handle the salt much better than if you have high sodium and low potassium. Susan was 68 and had been on a strict low-salt diet for 2 years, avoiding restaurants and obsessively reading labels, yet her blood pressure hovered stubbornly around 140. She felt weak, fatigued, and honestly quite miserable because she had eliminated so many foods she loved, yet the reward, lower blood pressure, wasn't happening. When we looked at her diet, we realized that while she had successfully cut sodium, she was barely eating any potassium-rich foods, living mostly on rice, toast, and boiled chicken. Her body was holding on to every milligram of sodium she did eat because there was no potassium to signal the kidneys to flush it out. Potassium acts as the natural antidote to sodium. It relaxes the walls of the blood vessels and helps the kidneys excrete excess sodium through urine. When you increase your potassium intake, you are essentially telling your body to let go of the water weight and tension that keeps blood pressure high. We didn't ask Susan to cut more salt. Instead, we asked her to add potassium-rich foods like avocado, spinach, sweet potatoes, and white beans to her daily rotation. Within a month, her energy levels returned, and her blood pressure finally started to drop, moving down into the 120s for the first time in years. This supports steadier readings because you are treating the root cause of the fluid retention rather than just fighting the symptom. It is critical, however, to get your potassium from food sources rather than supplements unless your doctor prescribes them. Potassium supplements can interfere with certain blood pressure medications and can be dangerous if your kidney function is compromised, which is a common issue for seniors. Food sources are generally safe because the body absorbs the mineral more slowly and can regulate the levels naturally, providing a safe buffer that pills cannot match. If you have advanced kidney disease, you must be very careful with potassium and follow your specialist's advice strictly, but for the average senior with normal kidney function, shifting the focus from no salt to more potassium can be a game changer. It opens up a wider variety of delicious foods and moves you away from a mindset of deprivation toward a mindset of nourishment. Susan found that by simply adding a side of spinach or half an avocado to her lunch, she was doing more for her blood pressure than she ever did by counting grains of salt. The hidden reading of this ratio is often missed because standard blood tests simply say normal for potassium, but normal isn't always optimal for blood pressure control. You want to be ensuring a steady supply throughout the day to keep that pump in your cells working efficiently. It is a longer-term lever that builds a foundation of health, making all the other strategies we discussed, like hydration and movement, work even better because the chemical environment of your blood is finally balanced. 8. You need to monitor for the postprandial drop, which is a massive, hidden crash in blood pressure that happens specifically after you eat a large meal. Most seniors are vigilant about checking their numbers in the morning or evening, but almost no one checks their pressure 45 minutes after lunch, which is exactly when this dangerous fluctuation strikes. This is the direct opposite of high blood pressure. It is a sudden, precipitous drop that leaves the brain starving for oxygen precisely when the digestive system is demanding all the blood flow. It is a leading cause of unexplained fainting spells in older adults, often dismissed simply as an afternoon nap or fatigue, when in reality it is a cardiovascular event. Henry was an 80-year-old grandfather who loved his Sunday roast dinners, but his family noticed that every Sunday afternoon he would become strangely confused, slurring his words slightly, and eventually falling into a deep, almost unshakable sleep in his chair. They worried he was showing early signs of dementia or having mini-strokes, but his morning doctor's appointments always showed him to be sharp, alert, and physically robust with normal blood pressure. The clue came when he actually fainted one afternoon while trying to walk to the garden just an hour after a heavy meal of steak and potatoes. We asked him to measure his blood pressure exactly 1 hour after lunch, and the results were startling. His robust morning pressure of 130 had crashed to 90/55. This phenomenon occurs because digestion is an incredibly energy-intensive process that requires a massive volume of blood to be diverted from the rest of the body to the stomach and intestines to absorb nutrients. In a younger, more resilient system, the heart pumps faster and the blood vessels in the legs constrict to compensate for this shift, ensuring that blood pressure to the brain remains stable despite the diversion. As we age, however, that compensation mechanism becomes sluggish and stiff. The blood rushes to the gut, but the rest of the body fails to tighten up, leaving the brain with a sudden drop in pressure. This is why Henry felt confused and sleepy. His brain was literally operating on low voltage because his stomach was hogging the power supply. To manage this hidden drop, you do not need medication. You need to change the mechanics of how you eat. Instead of eating 3 large heavy meals a day, which require massive blood diversion, you should switch to 5 smaller, lighter meals spaced out every 3 to 4 hours. This places a much smaller demand on your circulatory system, preventing that massive gut rush of blood and keeping your brain well oxygenated throughout the afternoon. For Henry, simply splitting his large lunch into 2 smaller portions eaten at noon and 3 p.m. completely eliminated his afternoon confusion and stopped the fainting spells. Another helpful step is to remain seated or reclined for at least 60 minutes after a major meal if you are prone to this issue. Trying to go for a brisk walk immediately after a heavy dinner demands blood for your leg muscles at the exact moment your stomach is demanding blood for digestion, creating a tug of war that the brain usually loses. By resting, you allow digestion to initiate without competition. Furthermore, be cautious with alcohol during meals. Alcohol dilates blood vessels even further, compounding the drop and making the crash much more severe. If you feel sleepy or dizzy after eating, check your pressure. You might find the hidden answer there. 9. You must be aware of the painkiller spike, a hidden saboteur that can secretly raise your blood pressure even while you are taking your heart medication perfectly. Many seniors live with chronic pain from arthritis, back issues, or old injuries, and they routinely reach for over-the-counter pain relievers like ibuprofen or naproxen to manage their daily discomfort. What most people do not realize is that these common drugs, known as NSAIDs, act directly on the kidneys to cause fluid retention and constriction of the blood vessels. You might be eating a low-salt diet and taking your blood pressure pills, but if you are also popping 2 ibuprofen every morning for your knee, you are chemically canceling out your efforts. Linda was 73 and had been battling high blood pressure for a decade, but for the last 6 months her numbers had been creeping up uncontrollably, reaching 150/90 despite her doctor increasing her dosage. She was frustrated and scared, believing her heart was failing, and she was strictly following every dietary rule given to her. During a thorough review of her daily habits, she casually mentioned that she had started taking an over-the-counter anti-inflammatory every morning and night to help with her worsening hip pain. She didn't think it was worth mentioning because it wasn't a prescription, but that simple pill was causing her kidneys to hold on to sodium and water, driving her pressure up by 15 points. NSAIDs work by blocking certain enzymes that cause pain and inflammation, but those same enzymes play a crucial role in regulating blood flow to the kidneys. When you block them, you reduce the kidney's ability to filter out excess fluid, turning your body into a pressurized balloon. For someone with high blood pressure, this fluid retention is dangerous because it increases the volume of blood the heart has to pump, directly opposing the diuretic medications that are trying to lower that volume. It creates a chemical war inside your body where one pill is trying to flush fluid out and the other pill is locking it in. Once Linda switched to a pain management strategy that didn't involve NSAIDs, using acetaminophen, which has less effect on blood pressure, alongside topical creams and physical therapy, her blood pressure dropped back down to safe levels within 10 days. Her doctor was able to reduce her heart medication back to the original dose, proving that her worsening condition was actually just a drug interaction she didn't know existed. This is why you must always tell your doctor about every single pill, vitamin, or supplement you take, even the ones you buy at the grocery store. If you have kidney disease or heart failure, the risk is even higher, and you should likely avoid NSAIDs entirely unless a specialist monitors you closely. There are safer alternatives for pain relief that do not spike your blood pressure, such as topical gels that treat the joint directly without entering the bloodstream in high concentrations, or heat and cold therapy. Do not let your pain management destroy your heart health. Checking this hidden interaction could save you from unnecessary heart medications. Comment yes below if you take anything for joint pain, and let me know if you check your pressure afterwards. 10. You need to investigate the nighttime non-dipper status, which is a hidden reading that happens while you are asleep and cannot check it yourself. In a healthy cardiovascular system, your blood pressure should naturally drop by about 10 to 20% during the night, allowing your heart, kidneys, and arteries to rest and repair after the stress of the day. This is called dipping. However, for millions of seniors, this dip never happens. their blood pressure stays as high at 2 a.m. as it is at 2 p.m., meaning their organs are under constant, relentless hammer blows of pressure 24 hours a day without a single moment of recovery. George, a 67-year-old retired truck driver, had acceptable readings during his daytime checkups, but he suffered from unexplained fatigue and early signs of kidney strain that didn't match his normal daytime numbers. His wife mentioned that he snored loudly and often gasped for air during the night, a classic sign of sleep apnea, but George dismissed it as just heavy sleeping. We arranged for him to wear a 24-hour ambulatory blood pressure monitor, a device that stays on your arm and inflates every 30 minutes, even while you sleep. The data revealed the hidden truth. While his daytime average was 130, his nighttime average stayed exactly the same, never dipping below 125. This condition, known as non-dipping, is one of the strongest predictors of stroke and kidney failure because it robs the body of its essential recovery time. The primary driver in George's case was undiagnosed sleep apnea. Every time his throat closed and he stopped breathing, his oxygen levels dropped, sending a panic signal to his brain that spiked his adrenaline and blood pressure, keeping him in a high-stress state all night long. He was essentially running a marathon in his sleep. By treating the sleep apnea with a CPAP machine, George's airway stayed open, his oxygen levels stabilized, and for the first time in years, his blood pressure finally dipped at night, giving his kidneys the rest they desperately needed. If you cannot get a 24-hour monitor, you can look for clues yourself. If you wake up with a headache, if you feel unrefreshed despite 8 hours in bed, or if you have to urinate frequently during the night, nocturia, these can be signs that your blood pressure is not dropping. High nighttime pressure forces the kidneys to continue filtering urine at a high rate, waking you up to use the bathroom. Treating the underlying cause, whether it is sleep apnea, a late sodium-heavy dinner, or simply taking your blood pressure medication in the morning instead of the evening, can restore this natural rhythm. Talking to your doctor about chronotherapy, the timing of your medication, is a powerful step. Taking at least one of your blood pressure medications at night rather than in the morning can often force the body to dip, restoring that protective rhythm. For George, the combination of the CPAP machine and switching his medication time saved his kidneys from further damage. Do not assume you are safe just because your daytime numbers are fine. The night hides the truth that matters most for your long-term survival. 11. You should perform the ankle check to reveal the hidden connection between your legs and your heart, specifically looking for peripheral artery disease. Blood pressure is not just about the numbers in your arm. It is about how blood flows to the furthest reaches of your body. If the arteries in your legs are clogged or stiff, your blood pressure reading in your ankle will be significantly lower than the reading in your arm, a discrepancy that is a major red flag for body-wide atherosclerosis. This is a hidden reading because, again, almost no one puts a blood pressure cuff on their ankle at home, yet it offers a window into the health of your entire vascular tree. Nancy was 75 and complained that her feet were always cold and that her calves cramped up whenever she walked to the mailbox. She thought it was just old age or perhaps a lack of potassium, so she ate bananas and wore wool socks, but the cramping got worse. When we measured her blood pressure in her arm, it was 140, but when we measured the pressure in her ankle, it was only 90. This massive drop meant that blockages in her leg arteries were preventing the full pressure of the blood from reaching her feet, a condition that is highly correlated with blockages in the heart and brain as well. This measurement is the basis of the ankle brachial index, a test usually done in a clinic, but you can pay attention to the physical signs at home. If you have hair loss on your toes or lower legs, if your toenails grow slowly and are brittle, or if the skin on your shins looks shiny and thin, these are visible readings that your blood pressure is not reaching the extremities effectively. The danger here is not just the leg pain, it is that if your leg arteries are plaque-ridden, your heart arteries likely are too. Nancy's leg cramps were actually angina of the legs, a warning sign that she needed aggressive management of her cholesterol and blood pressure to prevent a heart attack. Walking is the best therapy for this, even if it hurts initially. The stop-and-go walking technique, Walking until it hurts, resting until the pain goes away, and walking again stimulates the growth of collateral blood vessels, which are tiny natural bypasses that route blood around the blockages. Nancy started a dedicated walking program, and over 6 months, her walking distance tripled, and her feet became warmer as circulation improved. She treated her legs, but she saved her heart. Most older adults can try this safely. Simply look at your feet today. Are they pale when you elevate them? Do they turn red when you dangle them? These color changes are your body giving you a blood pressure reading without a cuff. If you see these signs, ask your doctor to check your pulses in your feet. It is a hidden piece of data that completes the puzzle of your cardiovascular health. Here is another simple habit. Keep your legs warm at all times. Cold arteries constrict and reduce flow further. Wearing warm socks and avoiding exposure to extreme cold can help maintain what flow you have. But remember, the pain in the legs is a siren for the heart. Do not ignore it. Conclusion. We have now uncovered the hidden landscape of blood pressure that lies beyond the standard 120/80 that you see at the doctor's office. From the stand-up test that reveals if you are at risk of falling, to the pulse pressure gap that measures the stiffness of your arteries, and finally to the nighttime dip that determines if your organs are truly resting, you now possess a complete toolkit for understanding your own body. You have learned that normal is not just a single number sitting in a chair. It is dynamic. It changes when you stand, when you eat, when you sleep, and when you are stressed. By monitoring these hidden readings, checking your morning surge, watching for the post-meal drop, and ensuring your cuff fits correctly, you are no longer a passive patient waiting for a diagnosis. You are an active participant in your own survival. Remember the stories of Arthur, Margaret, James, and the others. They were all doing the right thing by standard measures, yet they were still at risk because they were missing these critical nuances. By applying the small, calm, consistent changes we have discussed, like the hydration buffer, the isometric hold, and the potassium-sodium balance, you can stabilize these hidden fluctuations without always resorting to more medication. Blood pressure is not a disease you have. It is a language your body speaks. It tells you about your hydration, your stress, your arteries, and your heart strength. Now that you know how to listen to the hidden words in that language, you can respond with wisdom rather than fear. You have the power to protect your brain, your kidneys, and your independence simply by looking deeper than the surface numbers. If you found these hidden tips helpful, please share this video with someone you care about who is over 50. It might just be the information they need to prevent a fall or save their heart. And subscribe for more simple, senior-friendly blood pressure guidance that puts you back in control of your health. Thank you for watching, and I wish you steady numbers and strong health.